And welcome so much to the Roanoke City and Allegheny Health District's first live town hall. We are delighted to be online tonight. And the purpose of tonight is to have a relaxed conversational question and answer period. We do have a topic prepared based on the kind of things that we're hearing in the community. Tonight, we're planning to be talking about vaccine reluctance, and many people were very eager to receive their vaccine. They were so looking forward to it. And so for so long, we had more demand and not enough doses to go around. And then faster than we thought, which is a very good thing, enough doses arrived in our area, and we were able to begin to offer clinic openings that we could post on Facebook. We were able to advertise them through the media. And that was a really great opportunity. And so now we're looking to reach out to people who might still be on the fence. And particularly, we've heard that in some households, maybe there were people who were very eager to receive the vaccine, and maybe some other people who maybe need a little bit more time, wanted to hear a little bit more about the pros and cons and make a better decision for themselves. So tonight we are delighted to have a time to be able to talk about this. And it's my pleasure to welcome the director of our health districts, Dr. Cynthia Morrow. So tonight what we will do is we're going to have a conversation and invite folks to be able to ask questions that they may not have had a chance to get answered elsewhere. And all we'll need to do is just, you'll be able to unmute your line, or you can type your question into the chat box, and we'll be glad to field those questions. For now, Dr. Morrow, we will get ready to get started. It looks like it's about 7:02. And thank you again to our host, City of Roanoke, and to Tiffany Bradbury. Tiffany has given us this platform, this Zoom webinar platform. And so Tiffany, hi, Tiffany. Thank you so much for helping us with this. We could not have gotten through this pandemic without partnership. So thank you very much.
It is our pleasure. And I am here, and we'll be checking your Facebook page and the city's page, and I'll pop any questions we have in the chat.
Super. That sounds just great. And so what we'll plan to do is we'll just let everybody stay muted through the opening part while we go through the presentation, and then we'll unmute lines. And as I said, you can type your questions into the chat box for any kind of questions that you have along the way, and we'll pause and answer them. We expect this opportunity tonight will be about 30 minutes, but don't worry if you have questions that you think of later. I expect that we'll be scheduling more of these as time goes along. So for now, I would like to introduce the health director for the Roanoke City and Allegheny Health Districts, Dr. Cynthia Morrow. She is also the co-domain leader for the Health Systems Science program at the Virginia Tech Carilion School of Medicine. She's an internal medicine physician by training and a public health professional by career, who prior to joining us in Virginia, she spent the last 15 years as a public health leader in Syracuse, New York. So Dr. Morrow, we welcome you to give us a situation update. Where do things stand in the Roanoke City and Allegheny Health Districts?
Well, I think one of the things that's really important for us to understand is that COVID still has a significant footprint in our community. This past week, we reported over 300 new cases of COVID. We continue, unfortunately, to have people in the hospital. Over 30 people have been hospitalized every week for weeks and weeks. And unfortunately, we still have members of our community who are passing away with COVID. And so it's really important for us to do everything that we can to protect ourselves and to protect our loved ones. That means that for now, we have to continue to wear our masks. We have to continue to keep our physical distance. We have to continue to wash our hands, which we should always be doing. But the most important tool that we have in our toolbox right now is our vaccine. So with respect to our vaccine situation, and I don't know if we want to put up the slide that has the numbers on it.
Sure, that sounds
we
good.
have Christie has prepared some slides, and we can go to the next slide, which has some numbers on it.
Let's see, let me figure out which button advances it.
It's always important to to try our technology. So these are data from the state Department of Health's website, and we check these data all the time. But what we're seeing in Virginia is that about 40% of our population has been vaccinated with at least one dose, and 25%, so a quarter of us, have been fully vaccinated. Now, if we look at the jurisdictions within the Roanoke City and Allegheny Health Districts, we can see that there's variable uptake of vaccine. So in Covington and Craig, our rates are lower than we would hope. You can see those numbers there, 31% in Craig, who have received one vaccine, 32% in Covington. And in some of our communities, we're outperforming the state. So in Roanoke County, about 48% of our population has been vaccinated with at least one dose, and 34% with fully vaccinated. And while those numbers are relatively good compared to some of the other places, and certainly across the country, there's variable uptake, we're not where we need to be to really protect our entire community. I was just talking to someone earlier today, and they know 15 people who have gotten COVID in the last week or so. And it's just really important for us to continue to do everything in our power to decrease the impact that this pandemic has had on our community. One of the things we really want to focus on today is what people can do if you are vaccinated, what you can do to encourage other people to get vaccinated. And that's really the key point of today's discussion, but we are open to answer any questions that you may have. So if we can just go to the next slide. So what our focus is going to be is just tips, and this is from an article. We've just extracted this. It's a lot of it's common sense, but we've extracted these specific talking points from an article from Virginia Commonwealth University, VCU. Okay.
Yes, and that's excellent. So Tiffany, are you able to launch the poll? Yes. All right. So folks can weigh in. If you've personally talked with someone about their reluctance to take the vaccine, what reason have they given you for hesitating? And so you can pick any one of these choices. And maybe they have said, oh, you know what, I just don't have the time to do it. Or maybe they're worried about vaccine safety. Maybe they want to hear more about that, worried about side effects. Or they think, you know what, this whole thing just doesn't apply to me. I'm not worried about catching COVID at all. Or maybe they've said something else. So go ahead and weigh in, and we'll see how the results of the straw poll tonight, how they turn out. Interesting to see a reflection in the community. Let me advance. All right. So Dr. Morrow, if you'd like to go through, oh, let's see here. It popped back up.
Yeah, I think that it may not have.
Did you see the poll? Okay.
Yeah. Okay.
Several people are starting to vote. Yeah, Tiff, you can play with it. If there's a way that you can leave it open, that would be great. We could just leave it open while we talk, and people can have a chance to weigh in. Otherwise, that's fine. We can come back to that and talk about the various reasons that people have heard about it. Dr. Morrow, if you'd like to go ahead and walk us through some of the tips that you've come up with.
Yeah, and I think it is important for one of the first things to do is to really try to understand where someone is coming from. And so I think what the most important thing is to ask the specific reason. I do this every day, several times a day. If someone says, I'm just not so sure about the vaccine, can you help me understand what your concerns are? And then I can more specifically address their concerns. I think that it's hard for us to just, I think for those of us who really believe in the vaccine, it's hard to sometimes be patient. And it's just so important to be patient and really try to understand where the person is coming from. So for example, when looking at some of the ideas of is it because they don't have time, it's not important to them? Well, that could be a question of, well, would it be helpful if I help you find a place or find out what if you don't have time? Oh, did you know that there was a clinic here on a Saturday, or whatever the issue is? If someone says, well, I don't think that vaccines are safe, that's a whole different conversation to have. And I think understanding vaccine safety is something that we hear a lot about. And I know, especially in light of what happened with Johnson and Johnson, just as an example, last week, people say, well, I don't know if the vaccine is safe. For me, what happened with Johnson and Johnson last week, when we heard that there was a pause on the vaccine, to me, that's proof of how our system works to ensure vaccine safety. Within just a short period of time of identifying that there was a potential concern, the vaccine was put on pause so that we could assess and really make sure that the vaccine is safe. And that, to me, is such a reassuring point, is that we have vaccine safety processes in place, and we can be confident that any vaccine that's on the market is safe because of these protocols that we have in place. Now, for example, if someone says they rushed the vaccine, I don't trust the vaccine because it was rushed. That's something that you may or may not feel comfortable answering. But if you don't, you can talk to a healthcare professional. What I can say is, if someone says to me, well, that vaccine was rushed, the truth is, it is both the mRNA vaccine, so Pfizer and Moderna, and Johnson & Johnson, which is an adenovirus vector vaccine. The technology is a relatively new technology, but these processes weren't rushed. These processes, they've been building on these processes for over 10 years. And all of the vaccines that are currently under emergency use authorization in the United States have gone through extensive clinical trials to ensure that they are both effective and safe. So again, these are just examples of reasons why people might not want to get the vaccine right now. I think one of the most common things that I hear is, well, I just want to wait. I just want to see how it does in other, how it does. The clinical trials weren't very long. I want to see how it does. Well, the reality is that across the world, hundreds of millions of people have been vaccinated. That's a lot of information. We have a lot of proof, both for the effectiveness and the safety of this vaccine. So when people say to me, I just want to wait a little bit, my reaction is, well, can you help me understand what you're waiting for? Because every day that you wait, when there's still COVID activity, you're taking a chance of getting a disease that could really hurt you. And we certainly have the evidence that these are safe and effective vaccines. So I think that those are really, really important points to keep in mind. And the second thing that we really want to encourage people to do is to be really empathetic in the response. It's easy for us to be judgmental, and that never helps. It's important for us to really be empathetic. And if someone says, well, it worries me, I don't know enough about this vaccine, I think it's reasonable to say, I can understand that. I understand that this is a new virus, it's a new vaccine, and that makes a lot of sense. What can I do? What kind of information do you need that would reassure you? So something like that. And then one of the things that I know Christie and Tiffany and I all do is share our stories. So I know that my mother is one of our attendees, and I like to share stories. I like to share stories about our family's experience with the vaccine. And for us, it was such a moment of relief when we were able to make sure that my mom was vaccinated, because she is older, she's at higher risk of having poor outcome. And so for us, getting that vaccine was just such a sigh of relief to make sure that mom was protected. And the other thing that I hear all the time is, oh, I'm worried about getting a fever, or I'm worried about the side effects. I like to joke about in our family. So my husband got one of the vaccines. He's a physician, and he had a fever. Mom and I got the vaccine, and we didn't even know we got vaccinated, other than having a little bit of a sore arm. So telling stories and making it feel real can be really, really helpful. And then the big thing, I was just talking to a group of young people today, none of whom was arguing at all. But the big thing that I was trying to help explain is I am not going to try to force anyone to get a vaccine. I'm not going to argue with anyone. But what I do want to do is understand where they're coming from. And I want to make sure that they have the correct information. So it's not about arguing. It's about making sure that if there is misinformation, we can make sure people have the tools that they need, and not argue, but just present the information that we know. And I think if we want to go on to the next couple of myths, or the next couple of things. Yes, so we all know with social media that we can talk about getting into arguments. We can get into arguments on social media, and that's really not the best place for us to have discussions. The best place for us to have discussions is one-on-one, face-to-face. And while being on Zoom and Facebook Live is not the ideal situation, I would love to be sitting with you having a cup of coffee right now. The reality that this is an opportunity for us to have a face-to-face discussion, even if it's not in person. So take the discussions offline, really engage with people one-on-one. If it's a family member, make sure that you have the time to sit down and really talk with them. What we've been talking about for the last few minutes is replacing myths with facts. And certainly we on the Roanoke City Allegheny Health District, we've posted some newsletters about myths versus facts. The Centers for Disease Control has really good information, and the Virginia Department of Health. So we really encourage folks to get as educated as they can about the truth about vaccine, about COVID-19, and make sure that we're talking about truths, not myths. And so really that's the bottom line for us, is to make sure that we're equipping people with the best information from the best sources so that they can make the decisions that are best for them. And I hear a question. Sorry, I had to put my glasses on. A question from Facebook. How are antibodies different between those who have had COVID-19 disease and those with a vaccine? Are there ranges of antibodies? Does it just measure if it's present or not? So that's a really great question. And unfortunately, it's a really challenging question to answer, because a lot of the information about this is still unfolding, and it really depends specifically on the types of antibodies that particular lab is running. So I don't have a specific question. The one thing that I can tell folks, there are two different types of testing for COVID-19. They're what we call viral tests, which test for the presence of the virus. So either a PCR test or an antigen test. And there are antibody tests. And the viral test, the PCR and the antigen test, those are not affected by the vaccine at all. It's not possible to get a positive PCR or positive antigen test if you get vaccinated. those two tests test for the evidence of the virus. But the antibody test should be interpreted with caution. And I would strongly recommend that if you have any questions, depending on the lab that does the antibody test, there should be notation on it. But I would suggest that anyone who has an antibody test and is wondering whether it's because of vaccine or prior COVID exposure, they should talk to their provider about that.
Great, thank you.
Sure.
What do you think is people's top concern? What do you think is the thing that you hear most? Because I've heard a few things, but I'd be interested to hear what do you think that you're hearing the most about, and that might have changed over time.
I think it really depends on where you are. And different communities may have different questions. I think that the thing that I hear the most is concern about these new vaccines, and that whole concept of, I just want to wait a little bit. These are new vaccines. They haven't really been tested that much. I just want to wait. We have someone in our own VDH family who keeps saying, well, I just want to wait a little bit longer. And I keep saying, well, what exactly are you waiting for? Help me understand this. And I think that I think that that's probably the most common thing. What we talked about before, sharing the story, what I have heard a lot is once someone knows someone who gets it and realizes that it's just like every other shot, I think that becomes very reassuring. And so I think that the more people who get vaccinated, who share their vaccine stories, I think that the more that narrative gets out there, the more comfortable people will be. The other thing that I just want to add to that is that we know across the country that when the vaccines first came out in December, there were very high levels of people that were not interested in getting vaccinated. And now over time, now that the vaccine's been around for 5 months, that vaccine hesitancy has really dropped and confidence in the vaccine has significantly improved. And that's, our job now is to try to understand what the concerns are and to be honest and empathetic in our reaching out to people who may still have concerns.
I know many weeks the media have asked you, Dr. Morrow, what kind of reactions are you seeing at your clinics? Mm-hmm. And what kinds of things are being reported to you as far as side effects and reactions? And it's always a great answer that you're able to give.
Well, I think that the most immediate answer is we're really not seeing anything right there at the clinic. With everything, there are going to be a few people who get a little bit lightheaded after they get a shot, and that's really sort of just a reaction. Some people just react when they see needles. My daughter is one of them. She was sitting on my lap and getting her shots until she was 18. So there are some people who are nervous, who have what we call a vasovagal reaction, but that's really the only thing that we're seeing in our clinics. Over the last 5 months, we've had a couple of people who we thought may have had a bit of an allergic reaction, no anaphylactic reactions. And we provide them with the care that they need. We assess them and we make sure that everybody's okay. But overall, overwhelmingly, the experiences, we don't see any bad reactions in the clinic, period. What we do know, and we need to be truthful about this, is that there are going to be people who develop a mild fever, who develop a headache or body aches after they get their first shot. It's more common to have those symptoms after the second shot. Up to 15% of people may have some symptoms after the second shot. And my response to that, actually, I'm not even going to give my response to that. I'm going to give the response. I was talking to this older gentleman up in Covington one day at one of our clinics, And we were talking about possible side effects. And he said, oh my gosh, I would much rather have one day or even half a day of having a fever than having a week or 2 weeks of feeling really miserable and or the possibility of being hospitalized. And he really had put it in great perspective. And that is, I don't mind if I have a sore arm or body aches or a headache for a day, as long as it means I don't get COVID.
Right. Absolutely. Well, and so along those lines, let's just say that you had a magic wand of some sort. If you could pick an area for science to make faster progress, to tell us something about COVID that we don't already know, what do you think would be, an area of research that it would just be really great if we were able to, know a little bit more about this brand new disease that has just been around us in the last year or so?
Well, I think that the most important thing is that right now, we don't know what the future holds in terms of whether we'll have baseline circulating coronavirus like we have baseline circulating influenza virus. And we, with influenza, with seasonal flu, we know every year, usually between September and April, we're going to have to deal with flu or hopefully get the flu shot so that we don't have to deal with flu. So I think moving in, if I had a magic, ball and I could look into it and say the crystal ball and figure out what was going on, I'd really want to know, what does this look for us? And is there anything that we can do to really eradicate this now before it becomes part of what we have to deal with and get annual shots for the rest of our lives? We just don't know that yet. And so I'd really want to address that.
That would be great to know.
Yeah.
It looks like there's a question from the chat. If one is fully vaccinated and works in a nursing home, do you feel it's necessary to be COVID tested weekly?
Well, so that's a really important question that I would have to defer to the organization, just because I can't make policy decisions for long-term care facilities. In general, the guidelines are that if you are fully vaccinated, there would be no reason to be tested. And if you're fully vaccinated, there's no reason for, if you are exposed, to have to be quarantined. So for example, if for some reason I found out that I was exposed at work, which hopefully would never happen because we're mainly vaccinated at the health department. Almost all of us are vaccinated at the health department. But let's say I was exposed, I wouldn't have to quarantine. Now, the challenge with long-term care facilities and hospitals is that because the risk is so much greater when you're taking care of people who are extremely vulnerable and are at much higher risk of being hospitalized or even dying if they get COVID, the policies may have to be much stricter. And so I'd really have to defer to the organization to help to better understand why they might have a policy about testing or what their requirements are for people who are fully vaccinated. But for most of us, if we're fully vaccinated, there are a few advantages. If we're fully vaccinated and we happen to be exposed to COVID, we do not have to be quarantined. If we're fully vaccinated and we're around other people who are fully vaccinated in small groups, we can take off our masks, which I can tell you, the health department, the very first day that CDC guidelines came out, we were in a small group in a meeting, and there weren't too many of us. Exactly what Christie did. We all looked at each other and were like, we're allowed to take off our masks. But that's because we were all fully vaccinated.
It was a great day.
Yeah, it was a great day. And we still are very happy that we can have meetings and not take our masks off. But if there's one person in the room who's not vaccinated, the masks go on.
Right. It's important to continue to be safe, as you've said, at every turn. It's so important that we have to keep up these mitigation measures until we can get all of these reluctant community members and loved ones to go ahead and take up the vaccine. We need to reach that level. We don't know exactly what the number is, but we think it's higher than, we know it's higher than
It's
what we
definitely
are
higher
now.
than what we have,
Well,
right?
yeah, we think we need to be in more of that 75 to 80%
80%.
category, and we're not there yet. So we'll continue to do those mitigation measures. Well, Dr. Morrow, thank you so much for your time tonight, and really appreciate everyone who joined in with us tonight. We're hoping that this will be the first of who knows how many of these as the community needs it. Dr. Morrow is more than happy to be available. We're so grateful to everyone who participated. Special thanks to the City of Roanoke and to Tiffany Bradbury for hosting tonight's platform. If you would like to schedule an appointment, we have a call center that's open every day, Monday to Friday from 9 to 4 at the number of 540-613-6597. We have special clinics that are going on in Allegheny and Craig, so they don't have to drive all the way down to Roanoke. And we can also plug people into CVS opportunities, that sort of thing. We can help them find those appointments. So we just want everyone to be healthy and safe. So again, Dr. Morrow, thank you so much. Tiffany, thank you. If anyone has any additional questions, you see my email address down at the bottom. And with that, I thank everyone. It was a big success tonight. We'll look forward to doing it again. Tiffany, any last words?
No, we're going to actually take this recording. We'll put it on the City of Roanoke YouTube page as well, and I'll share that with you all. And again, people can just keep dropping questions, and we'll make sure that it gets to the ladies that have the answers.
Yes, more than happy to. Dr. Morrow, any last words?
Yeah, I think that the one last thing I just want to keep in mind is that when we get vaccinated, we do it to protect our health. But for me, more importantly, I do it to protect the people I love. And so sometimes even just saying, hey, can you do this? Can you do this for grandma? Sometimes that is enough itself. So vaccinating ourselves protects everyone.
That's great. Well, great words to end on. Thank you, Facebook community. Thank you, RCAHD. And until next time, take care. Bye.
Bye.
Bye-bye.